So, anybody heard of coronavirus? Right? So it's been in the news. I'm sure you're watching. Oh, this is now the second person and the third person has it and all of that. I just want to talk about it a little bit because every time I see the headlines in that, I think it's valuable that they're focusing a lot on that. I think it's important because it's just an unpredictable thing. We don't know where it's going to go. And the mortality rate, in other words, if somebody gets the infection, what are the chances that person could actually have a fatal disease is high. You know, it's not like a regular flu thing. It's one of those things where the mortality can be like 40%. So 100 people get it, 40 people could actually die. But when we think about it, there is like, what, three people today infected in the US, I think, or exposed maybe? And the latest news is that it's coming from, it's potentially coming from, it's a zoonosis. Zoonotic diseases are viruses that actually emerge from wild animals when they are kind of penned and kept together for food. So in other words, it's kept in an unnatural condition in high density. They keep the wild animals together. These are viruses that actually belong only in the animals. They don't come to humans. But then these viruses become a little bit mutant, and their behavior changes based on the conditions they're kept. And wild animals should not be all together, hanging out all the time, all year, right? So that's the unnatural condition we create in this wildlife trade and eating wild animals. And that leads to creation of this SARS virus that we had in the past, H1N1, again coming from how the poultry were kept together. And now we have another virus, coronavirus. So these are all kind of a mutant things that turn due to unnatural conditions of how humans grow food or create conditions where they want to seek food. So I want to give a context for this. You know, you may be wondering, did I end up in the wrong discussion conference today? So I'm saying this to give you a context, because every 37 seconds today, there is one person who's dying of heart attack in the United States related to food. So we want to talk about, I just want to give you a context of, yes, we have 3 people with possibly infected coronavirus. It's hitting the headlines all across, right? What should have been in the headlines for the past 30 years, every single day, is the fact that there is food causing heart disease, diabetes, and cancer, and so many people are dying from it daily. Every 37 seconds, one person dying of heart disease, right? 1 in 4 deaths in the United States, 1 in 4 people dying is basically due to heart disease, right? 1 in 3 persons have high blood pressure. And when somebody gets heart failure, the mortality rate is actually 60%. We talk about coronavirus, 40% mortality. But when somebody gets heart failure, like after blood pressure is uncontrolled, or they get a heart attack and it's getting worse, all these things can lead to eventually what is called as a congestive heart failure, and there the mortality is high. In 5 years, the mortality is 60%. So if you think about it, the bright spot in all of this is that all of these food-related diseases that I mentioned, the heart disease, diabetes, and cancer, all of these can be predominantly fixed through dietary changes. So the solutions are right in front of us. And that's the hopeful message we want to bring through this discussion today, that I want to put things in perspective. So we want to talk about the scale of the issue we have, but also the opportunities we have with food. So I'll be focusing today on blood pressure, blood sugar, and heart health. In the heart health discussion, I'll be talking a little bit about heart disease and heart attacks and all of that. So blood pressure, there are 2 numbers. I may be touching some of the basic things you may already know. There are 2 numbers, how we describe blood pressure, systolic, diastolic, 2 numbers. The first number is basically determined by what is the pressure with which the heart actually pumps out the blood. So if the heart failure, whenever there is a heart failure, the heart becomes weak, the heart muscle becomes weak. The systolic, the first number, can actually go low because of that reason, can go very low, hypotension, right? The second number is determined by the tone of the blood vessel itself, the tone of the artery in between the pumps. In between the heart pumping at a baseline, what is the tone of the artery determines the diastolic blood pressure. More importantly, I want to talk about, we'll talk about the food and why just sodium. We always heard about low sodium diet, but we have evolved much beyond that. Low sodium diet is like 1960s, 70s discussion. Okay, so we have to move beyond that. I'm going to talk about what is a DASH diet, and it came in the 1990s, and now we have evolved more to understand how do we really manage high blood pressure in a much more comprehensive way through food. So I'll talk all about that. But I just want to talk quickly one thing about the importance of managing and not ignoring high blood pressure, because there are two things I want to talk about. It's good to understand when is it actually really like emergency when you have a high blood pressure, and that will be usually like when the numbers are more than 180, 190 on the first number. That's like a real emergency. Especially more than 200, right? It's a real emergency. But for numbers which are like 140, 150, 160, 170, it needs to be controlled. It has to be brought down to a better number, but it doesn't have to happen that day. So you don't have to run to the emergency room just because it's like 150 that day. So I'm just saying, I want to give a full perspective on that. So it is important to keep it under control. And why is it important to keep it under control? Is that I'm assuming virtually all of you would have at some point had blood pressure checked, right? So the nurse is, raising the blood pressure cuff, and it's going up. And what they normally do is they try to bring it up above the systolic, the first number. So they'll bring it up above 160, 180. And they're going to let it down. How does it feel at that time? You're waiting for the nurse to kind of finish that, right? You can't like wait longer. Just imagine that, so that the pressure that you felt at that moment is the pressure your heart is feeling when you have high blood pressure every minute, all day, all year. So that's the pressure your heart has to work against, like a pump. Like imagine there's a water pump, and there is like pipes, plumbing coming out of the water pump, and there is some kind of a kink on one of the pipes. So there is a pressure, extra pressure, and the pump has to work hard to push through that pressure. The same thing happens to the heart. The heart has to kind of work harder to pump against a high blood pressure because it needs to keep doing its job to push the blood circulation around. But when it does it, when there is a high blood pressure, the heart is working harder and harder to push through the extra pressure it has. So when that happens, what happens to the heart is it's like somebody is like pumping iron every day, like doing dumbbells every single day. So what's going to happen to the heart? The heart muscle is going to actually get bigger. When the heart muscle gets bigger, then we have some trouble with that. It can get weaker. There is already a circuit in place in the heart. Heart has circuit, electrical circuit in place. So when it gets stretched out and it gets bigger, what happens to the circuit? That goes off. Then you get atrial fibrillation and other things that happens because the circuit goes off when there is an enlarged heart. So all these complications leads to the congestive heart failure that I talked about. So I think it's important to understand that even though you may not feel the blood pressure when it's like 140, 150, 160, there's a lot of pressure that the heart is feeling like you would feel when the BP is getting measured. So it's important to look at why it is important to control that. And we can do a lot with food. This is just an example of, it's silent. It is silent, but it can be very damaging to the heart, the brain, and to the kidneys too. One of the common reasons for kidney failure, other than diabetes, is high blood pressure that is uncontrolled. So nutrition plays a big role. We'll talk a lot more about it. Stress management helps. You're managing the flight phenomenon, the adrenaline phenomenon, by making sure you're able to manage the stress and have coping skills around it. And physical activity definitely helps, especially through its ability to work on some of the blood vessel receptors, and also maintaining healthy body weight always helps. So, we have evolved, as I said, we have evolved beyond the sodium conversation. Low sodium is important, but more than that, increasing vegetables and fruit is important. So that's the understanding we have from this particular study that was published 1990s, 97 actually, to be specific. It's called the DASH, Dietary Approaches to Stop Hypertension. And it looked at the diet beyond just looking at the sodium content, and they found that increasing the fruits and vegetables and adding whole grains, it's anything you add more fiber, things that have more fiber helps that. Again, low-fat dairy was also found to be helpful in that study. And they also looked at the amount of sodium that is better. So if somebody already has a high blood pressure, then they found that with the amount consumed is 1,500 or less per day, that was better. And if somebody doesn't have high blood pressure but they want to kind of prevent it, then 2,300 milligrams is the recommendation. So to give you an idea, 1 teaspoon of a table salt has 2,300. So you want to think about, it should be less than that for the entire day. If you think about 3 meals a day, and if a lunch is prepared and there are 4 servings, and there is an amount of sodium that goes for those entire meal, and you take 1 portion of the 4 servings, you got 1/4 of the sodium that went in. So you can just think about how much is happening for the entire day for you. Anytime it's a home-cooked meal, it's going to be less. If there is store-bought or processed or packaged, it's not under your control how much sodium it goes into that. So anytime it's home-cooked, it's always better you have better control over it. I want to talk about a little bit on. So this is. Let me just go back. Excuse me. So this was after the 1990s. We really understood that we had to think beyond sodium, and then the studies that came about in the last 15 years, I would say, have shown that the more plant foods we have, the better. In every additional serving of fruits and vegetables actually helps to drop the blood pressure to a normal range better. So this was a study that looked at Adventist groups, and they looked at more than 34,000 individuals, and they found that in this population compared to an average population, their risk for blood pressure was cut by more than a half, 55%, based on their dietary intake. So there is a lot of interest from a medical research perspective in what's going on in the Adventist population. Just to pause briefly on that, because the Seventh-day Adventists have, from a religious philosophically, they have certain practices of avoiding meat, avoiding nicotine, smoking, and so forth. So, and there are different. Among them, there are different categories. So, like some of them are like they don't smoke, they don't eat any meat, they don't eat any dairy. They're like complete vegans, like clean, right? But there are some groups in them, they would eat some dairy and eggs, but they're vegetarians. So for us to study a large population, this is like a perfect field for us to look into. That's a population to study very easily because you already have built-in slight differences among different groups. So so there's a lot of studies that has been done on them, and the population, we have a good sample size. Anytime we do a research, it's always good to have a large sample to study because the accuracy of the data is better, and we have tons of data from large populations of Seventh-day Adventists. So this is one of the studies that really showed that the more, the better when it comes to dietary fiber-rich food, which is vegetables and fruits and whole grains and legumes. This was published 2017. This was a summary looking at all the evidence that has been there on plant-based diets and high blood pressure, basically taking us to the next level of understanding how these foods actually work. Because we know that we give certain pills for blood pressure, and we know how they work. How this food actually making it happen. So I found this list that I wanted to show. So these are the many different ways that adding a plant-based meal improves your blood pressure. So it actually opens up the diameter of the blood vessel. So when the diameter increases, the pressure drops, right? It works to keep the insulin response on the blood vessels in a better way, which actually helps with blood pressure. It decreases what's the thickness of the blood flowing in there, because you want the blood to not become thicker because it's going to clot. So, and actually that has an impact on the blood pressure as well. These are there are receptors. You heard of the term beta blockers, metoprolol, all those things. So those work on a particular receptor. Receptor is basically, imagine there is a site where this medication goes and attaches and works to open up the blood vessel. So those are called receptors. So food has been found to work in the same way, and you might have heard of medications like lisinopril and those kind of things. They work in the system in the kidneys called renin and angiotensin. That works there as well. And additional things like anti-inflammatory effect. Now we know that a lot of the diseases that we deal with relate to having some changes in the body called inflammation. I think Dr. Preda may be touching a little bit more on that. And so that works there as well. So the reason, when I saw this, I thought of patients I've seen in the past where they are on a bunch of medications. You probably know, you maybe, or you know of folks who are taking at least like 6 or 7 medications, maybe 3 or 4 of them are for blood pressure, right? It's not unusual to see that. And so it could be something like hydralazine that works to actually open up the blood vessels. That's what this medication does. And that medication does only that piece of that list, okay? Or it could be something like a medication that works on this renin-angiotensin, like a lisinopril or something like that. So if you look at this, I just started adding medications. I wanted to see how it'll all add up. And this may be I didn't have enough space to add, but you may have patients who are actually taking medications like this instead of just eating like a one-stop shop, which is going to take care of all of this so that you don't have to stand in the line in CVS to get all this. I don't have anything against CVS. I shouldn't have said the name of it. But, all the things you go through, like, you're waiting in the line, you're looking at the copay, reminders, the whole thing. Why? So the new medicine, one diet for many positives. So one diet that just takes care of, everything. So that, all these things can be fun. So we have a fantastic demonstration later on coming up to understand how actually we can actually make these meals. And I want to show, I have a lot of examples, but I just want to show one example which is relevant for the discussion. I have a patient, this is one of my patients. So this is 2013, and then I started following up this patient, and this number goes up to the 2014. This is actually a screenshot taken from his medical chart, where we take the vitals. And this is kind of the trend of the vitals. So this number that you're seeing is the body weight in pounds. So he started out with 265 pounds. At one point, he ended up with around 185, I would say. And but as his weight is dropping, simultaneously, you can see his blood pressure also is improving down to 108/62 from 158/94. So the point I'm trying to make there is, and this was working through dietary changes, and he was not even eating like 100% plant-based, which is not the expectation there. The idea there is to kind of increase plant foods, right? That's the bottom line. Wherever you are, you don't have to go from A to Z in plant foods. Just start moving from A if you're in A, right? The train is leaving. Your destination can be, you don't have to get to the final destination of Z, which is kind of 100% plant-based, but just get on the train and just at least whatever exit you feel like this, okay, this is where I feel comfortable, I'm good, that's fine. So the point I'm trying to make there is, I was working, when we work with the chronic inflammation and chronic diseases through dietary approach, we're not only fixing one thing like blood pressure, we're also fixing the body weight issue. We're also actually preventing diabetes or making the diabetes better, and we're decreasing inflammation in the joints, and we're actually preventing dementia, and we're making sure that the cancer risk is low. So it's one-stop shop, the approach through plant-based diets, because it attacks at the root cause of the problem. It prevents many of the diseases that we're seeing. Many of the diseases we see is basically, at the core, if you see, it's all related to 2 or 3 fundamental process that goes on in the body wrong. And if we can fix that through diet, we're just, reversing many of the issues at the same time with one diet. All right. I'm moving on to diabetes. So just some fundamentals. Healthy body, we eat food. Food has 3 major nutrients. Carbohydrates or starch is one of them, which is broken down into glucose molecules. It's a fuel. The body needs the glucose molecule to use it as a fuel. And in order for this fuel, the glucose molecules, to enter this little cell to be used as a fuel, we need insulin to actually help for the glucose to kind of cross over and enter into the cell to be used. And with the insulin being so important, if we don't have insulin at all, the body has no insulin. That could happen in juvenile type 1 diabetes, right? Then that person actually needs insulin, otherwise they may die. That's type 1. Or type 2, where there is some insulin, but there's not enough, and whatever is left is not working well. In other words, the body is saying, the insulin is trying to go and open the door for the sugar molecules to enter in the cell, and the body doesn't listen to the insulin's commands, because insulin is saying, open the door, get the glucose in, and the body is saying, no, I won't. In other words, body is resisting. And what is it called? Diabetes, yeah. Insulin resistance. It's called insulin resistance. Literally, it's called insulin resistance, which is pre-diabetes, which leads to diabetes, right? So insulin resistance, diabetes, they're all kind of one and the same in a way. But basically, there is a resistance to body's ability to respond to your own insulin, to open the doors, let the sugar molecules go into the cell to be used. And if that doesn't happen, the cells cannot utilize the fuel that we ingested, sugar, the carbohydrates. So it starts to build up in the blood. It can't get anywhere else. We are eating. It's building up in the blood. From the blood, it can't get into the cells. So what's going to happen to the level in the blood for the sugar? It's going to keep going up. It can't get anywhere else. So, but the cells are not getting the fuel that it needs. So how does a person feel? The diabetic person feels they're not getting any fuel. So they feel tired. So diabetic patients, one of the commonest things you would see is that it's just this performance across the board is going to go down. They're tired because the cells don't even get the fuel. But there's plenty of fuel in the blood, which is sugar, where it shouldn't be. It should keep moving into the cells. And the insulin is not working, or the body is not listening to the insulin. So that's kind of a fundamentals on diabetes. There is also different ways to explain. Like insulin is the kind of the key, and it opens the lock to get the sugar molecules into the cell. And anytime we actually eat food, it's not just about carbohydrates. That's one thing I want you to take home as a message from this discussion would be, diabetes is not just about starch or carbohydrates. It is also about what's the fat in the meal, how much fat there is in the meal. And also it is about the protein, the type of protein. And it is also about whether the food has dietary fiber or not. Fiber is good, right? Dietary fats, bad. Because what the fat does is, now we know from science that the fat actually goes and blocks this lock and key mechanism. It actually gums it up so that the key can't work. The insulin can attach and do its job to open up the cells for it. So dietary fat is important too for diabetes. It's not just about the starch. And there's a lot of complications that you might have already heard of from diabetes. Kidney failure is one dangerous one that happens with diabetes. Eye vision can be affected, blood vessels, heart attack, and the whole thing. But now we also know that dementia, Alzheimer's disease, is actually a long-term complication coming out of an uncontrolled diabetes. Every change that we see in the brain tissue in a patient with Alzheimer's, every single change that we see is now connected with how the insulin balance is abnormal in those patients. So it has to do with how the sugar control and insulin balance is done. So dementia is another complication we know. And then we also know now that diabetes is pretty much equal to aging. So if somebody has an A1C, have you heard of the number A1C? A1C is a short way of saying a particular name of a blood test called hemoglobin A1C, which is a way to measure how good the blood sugar control is for the person. So for somebody whose blood sugar is normal, insulin is working well, their A1C will be under 6, like under 6.5, it could be 5.4 or something like that, around 6. As somebody's diabetes gets worse, these numbers can go up. And they can go, some patients you would see very uncontrolled, it can be 12, 13%, right? So, but what we now know is that particular A1C number is actually an indicator of how fast the body is aging. In other words, you may have a 35-year-old person whose A1C is uncontrolled and the diabetes is 12%, 13%. For their body, their tissues, they are not 35-year-old. They are running around at the age of 45, 50. So the body is aging fast in that person. So, but when the diabetic person is able to control the diabetes better, and the A1C is actually improving and coming down, what they have done now is they actually slowed down the accelerated aging process that was happening. So, in other words, a diabetic person is able to slow down the aging as long as they can actually eat well and control the diabetes in a better way. So now we know that too. I don't know if I mentioned this or not. So the way I say it is that high blood sugar is the wrinkle in your blood. So when we talk about aging, all the changes that we see in aging, whether it's hair or wrinkle or joint arthritis, dementia, all of these are manifestations of a body degenerating faster or aging, right? So when we think about it, just imagine high blood sugar that is not under control. A1C is a sign that that person is aging faster. So one of the biggest rewards for just making sure you're controlling your diabetes in a better way is just making sure that you're not having an accelerated aging process that's going out of control. You're able to slow it down by making sure your diabetes is under control. Today, I think in the past I've talked about this AGE, not the age I'm talking about, advanced glycated end products. They're particular chemicals that you find in our bloodstream. They're called advanced glycated end products, shortly AGE, and it's age. So it's been correlated with whenever somebody is aging fast, their blood level of this advanced glycated end product, AGE, also goes up. When age goes up, right? And that age, advanced glycated end products, actually goes up anytime we eat food that is burnt, like charred, blackened food, is the fastest way to age. So if a patient comes to me and says, "Doc, I want to age really fast, what can I do?" I'll write down a list of all these charred foods and all these grilled foods to start with. And then it can be deep fried. Anything deep fried also goes up. It doesn't matter whether it's plant or it can be like potatoes. Yeah, deep frying, it could still push it up. So so we know that the age and the A1C I talked about, right? Advanced glycated end products, the age. One of the examples of that end product is A1C. A1C and they are one and the same actually. And we also know that the best fuel for the brain is actually not protein, it is carbohydrates. So starch, carbohydrates. And the reason is that brain is insulated from the rest of the body's environment, including the blood flow, through a very secure barrier it has between the brain and the body's blood. And once you're getting exposed to the blood, then you're getting exposed to everything that goes on in the body, right? If you for a particular organ, so for brain, it's insulated from everything goes on in the body because it has a particular barrier called blood-brain barrier, and it prevents. It's like a wall, a shield between the bloodstream and the brain itself, and it only selectively allows things to get into the brain. So in other words, if you need to get in there, you need to know the password. What's the password? Every time a molecule comes to the brain, it's going to say, tell me the password. And protein doesn't have the password. Fats doesn't have the password. The only thing that has the password is carbohydrates, starch, right? Fruits, vegetables, whole grains, whatever starch is left in legumes. They are the ones who can get in. Also, sugar, all these unhealthy carbohydrates can also get in. So anything that is starch, carbohydrates can get in. So if somebody is on all these extreme keto diets and all these things that are going on, high protein, no carbohydrate, low carbohydrate, you're basically starving the brain because protein doesn't have the password to get in the brain, right? So if you think about it, brain measures only 2% of the adult's body weight. Sorry, I'm still trying to work this out. Brain is just 2% of the adult's body weight, but it consumes 25% of all the carbohydrates we consume on a daily basis. So it largely depends upon carbohydrates for the fuel. Brain food is carbohydrates, that is healthy carbohydrates, healthy starch, and so dietary protein and fats cannot fuel the brain. So how can we preserve the marbles we have is basically by making sure that the blood sugar is under control. We know that type 2 diabetes and Alzheimer's dementia are related. Type 2 diabetes can be prevented and treated with the right food. The best way to defeat Alzheimer's disease is to prevent it. We do not have an effective treatment for Alzheimer's disease. And the best way to prevent Alzheimer's disease is by maintaining a normal blood glucose throughout your life. And so we have some studies I included for reference that how our memory and cognition is all important, and it all goes wrong in patients with type 2 diabetes. I talked about this. Brain insulin signaling is a fundamental process now in any of the Alzheimer's disease pathology changes that happens. And this is another study looking at diet. They looked at, this is a large sample, as you can see, 200,000 men and women followed for 20 years. So this is a fantastic study from a research perspective. This is like gold, right? Large sample size, followed for 20 years. And people did not have diabetes at the beginning. They followed their dietary pattern with annual questionnaires that they send. And they combined 3 studies, and they found that a healthy plant-based diet reduced the risk of diabetes by 30%, 34%. So this is the green one is the healthy plant-based diet. And I won't talk much about the blue zones. I think Dr. Priyadam may be touching on that, but blue zones are cultures where people on an average live up to the hundreds, like centenarian cultures, right? So Loma Linda, which is in California, is one of the blue zones in the world, right? And that's where you have a large density of Seventh-day Adventists. So this is another study something I referred to earlier on blood pressure, this Adventist study. This was again, a large population studied, 89,000 Adventists. They found that in Adventists who are eating vegetarian but including dairy and eggs, the risk of their diabetes was cut by 60% compared to a regular population. And if they were eating completely plant-based, their risk was like 80%. These kind of numbers, we don't get to see this kind of risk reduction in any of the pharmaceutical studies. You take any pharmaceutical study, you can't see risk reduction like 60, 80%, like what we're seeing with these food studies. This was 2018, the American Association of Clinical Endocrinology. In other words, if you have somebody who has diabetes in your family or friend or you, and if you see an endocrinologist, right, that endocrinologist, this is their association. This is the National Association of Endocrinologists, and they have put out an executive summary in 2018, basically saying the lifestyle therapy for diabetes should involve maintaining optimal body weight, making sure we don't consume excess calories, and plant-based diet with high healthy fats included. I shouldn't say high, just making sure you include healthy fats. I will explain the omega-3s in a minute. And then avoiding trans fats and saturated fats. I gotta shake this, I guess. Avoiding trans fats and saturated fats, and group support and replacing meals and all of that. So in other words, today's discussion and the cooking demo will pretty much be working on, these kind of recommendations is what we're going to look at. The other things the recommendation included was physical activity and good sleep and community support and behavioral support and stopping nicotine use. This was probably the first time they started including sleep in the recommendation for diabetes. Now new science has shown how the ability of the body to rest during sleep actually helps to restore some of the insulin balance. So I think it's important. A new inclusion in the diabetes recommendations that didn't used to be there in the past. So some basics on how do we treat diabetes with food. The food needs to be tasty. I mean, one of the things there was some cooking event I was at in one of friends' places, and one of the things I did say there was that in order to eat healthy foods and in order to keep it for a long term, there are two things that needs to happen, right? It has to taste good, and it has to be easy to do, right? So putting you on pressure more for today. So it has to be tasty. That's fundamental. And it has to be high in antioxidants, which is color, high in colorful fruits and vegetables, high in dietary fiber. So fiber-rich foods, those are the fiber-rich foods. And low in sugar, low in alcohol, and low in omega-6 fatty acids. Omega-6 fatty acids is one of those fats which are which creates more inflammation. It's in any of the cooking oils and in many of the baked goodies and all those things. So that is omega-6. We want to include more omega-3 fats whenever we can, and it should be low in animal protein because animal protein just gives you calories, and it doesn't bring a dietary fiber. It creates inflammation. It can give cancer, so all kinds of stuff going on. And of course, the charred, burnt, deep-fried food, unless you want to age really fast, then it's okay. All right, moving on to heart health. All right, how do we keep the motor pumping and the traffic flowing, right? This is a good data. So this was in 1991. The World Health Organization did this study with NIH in the United States. So what they looked at was, what you're looking at is, for each country, you're looking at a set of two bars. You're looking at a red bar and a green bar. The red bar is indicating the mortality rate, percentage of deaths from heart disease and cancer, right? And the green bar is basically showing percentage of their calories that they're eating that comes from plant foods. In other words, if we take for each country per capita, national average diet for each country, and you look at their caloric consumption, and you look at what portion of the calories are coming from vegetables and fruits and legumes, that is what is in the green bar. So you can clearly see that in countries where there is more consumption of plant foods, there is less mortality from cancer and heart disease. So it's a pretty neat visual, I think. And this one is just to understand heart disease and cholesterol. I know there is we have evolved to understand cholesterol and heart attacks in a much more much more refined way. In those days, we always thought, okay, cholesterol, heart attack. That's all. LDL cholesterol, that's all we knew, right? We have evolved from that. So let me just explain that. So it all starts with inflammation. Inflammation is basically your body has a response to an insult. So I will say if somebody has bronchitis, a viral infection causing bronchitis, that's an inflammation in the bronchial tubes, right? And there the insult was the virus. The virus is the insult. The bronchitis is an inflammation in the bronchioles. Somebody is, played sports in the young age, pushed too much, had a lot of injuries in the knee, and then started developing arthritis in the knee at a young age. So there, inflammation is in the joint, and the insult is the repetitive injuries, sports injuries that happened in the earlier on. So there is an insult, there is a response, right? And so similarly, if you look at everything that ends with itis, right? So that's all inflammation. Body also goes through something similarly whenever we consume food that creates inflammation. And if that meal doesn't have enough stuff in it to actually stop that inflammation. So there are foods that create inflammation, and there are foods that actually stops or reduces inflammation, anti-inflammatory foods. So it's just what's in the mix, what's on your plate. That's going to determine how much inflammation comes into the body, right? Inflammation, breakfast, lunch, and dinner, and snack. So if we keep adding that way, then the body can just, slowly gets into a trouble. And there is something called ABC transporter proteins. You would think that I actually made up that name, just ABC. It's actually called ABC transporter protein. And what it does is basically it's like a traffic police that controls the cholesterol. When we ingest, the cholesterol goes in, and then the body has to make sure the cholesterol does not end up in the arteries. The only goal for the body is to make sure the cholesterol that we eat does not go to the blood vessels, the arteries, and remain there, because it's going to start building as a gunk, and then it's going to cause all kinds of problems, right? It's going to build a blood clot, and then heart attack or stroke and all those things. So it has this ABC transporter proteins are this traffic police kind of things that just diverts these cholesterol molecules away from the blood vessels to the first pathway is actually to push it into the gut so that we eliminate it, which is the safest one, right? Out of the body. Great. That happens. The second place, if somebody's diet is still adding more and more inflammation and a lot of cholesterol and dietary fats coming in, then the next place it actually starts to pack away is in the liver. What do you call that? Yeah, it gets to cirrhosis down the line, right? But before that, it's called fatty liver. Just fat deposits, fatty liver. What happens in these geese that they force feed, right? Foie gras, right? Same thing. Too much calories, it's going to get packed in the liver. This fatty liver is basically body's way of trying to do its best to keep the cholesterol from going into the artery. So it's kind of a stage. So that's why you would see when somebody has fatty liver, you're already beginning to see that they are very likely to have diabetes. They're very likely to have, blood pressure and heart problems down the line. So I think it's just a sign. So body is doing everything it can to make sure that the excess cholesterol in the blood is packed away. But then whenever there is inflammation, more and more inflammation in the body, this traffic police, the ABC transporter protein, they don't work well when that inflammation happens. So the job of just avoiding cholesterol ending up in the arteries, that doesn't happen well when there is chronic inflammation, which leads to just cholesterol building up in the blood vessels, and it starts to develop a blockage in the artery, and the person at some point, when there's more inflammation, can develop a heart attack from that or a stroke from that. So in other words, the idea there is already inbuilt mechanism we have to make sure that the arteries don't get clots, don't get blockage. We already have things in place. But when there is more and more inflammation coming in because of the food choices we have, it just leads to a place where the cholesterol ends up in the artery where it shouldn't, and it starts to keep building up, and it gets inflamed, and it ruptures, and it develops into a heart attack. So heart disease is basically a disease of inflammation. So that's why I said we have to move away from or evolve from the idea that simple idea of cholesterol, heart attack. It's not just that. There's more to it. There is inflammation behind it, right? Excess of calories, fats, salt, and sugar all leads to inflammation. And then heart disease is also a disease of deficiency of nutrients. If you think about it, nutrition deficiency, you wouldn't think, when you think about nutrition deficiency, you're thinking different countries, right? You're not thinking United States of America, nutrition deficiency. Am I right? But heart disease is a disease of nutrition deficiency, of not having enough antioxidants in the food. If you think about it, so yeah, so if you don't have enough antioxidants, which is a healthy nutrient, then that also leads to heart attack. The way I see antioxidants is it makes sure that any toxic oxidant, free radicals, damaging molecules are neutralized by these antioxidants. So we need enough of them to actually help prevent heart disease as well. So this is kind of a new understanding of heart disease. And this is, and then we have, now we have data showing that we can actually reverse blocked artery. Artery is blocked already in the heart, and you can actually clean it up just with dietary changes. That includes all plant-based diets, and with an abundance of vegetables, fruits, legumes, and whole grains. Small amount of nuts and seeds, virtually no oil, no animal foods, no dairy, no eggs and fish, regular group meetings. This is very important. A lot of the studies that look at dietary interventions, they find that when people come together as a group, it actually makes a difference. Regardless of in addition to the diet, there is an extra element of the group setting helps, the social cohesiveness helps their disease outside of all the dietary factors as well. So this is actually a prescription right now. So this is a study that just shows that every additional fruit matters. Every additional vegetable you eat matters, right? Because you can see that for every serving you add, this is called a relative risk. RR is a relative risk, so it's expressed, the number should be less and less. So every serving we add, this is the servings per day, of fruits and vegetables. And so you can see that it starts to drop. So it's, in other words, in science, we call it dose-response relationships. As the dose increases, the response increases, which is kind of a very good proof that there is a correlation. So dose-response, and that's been seen. This is how much of the artery actually, the artery blockage opening up and getting cleaned up. And again, the more folks are following the diet, these are folks, who followed the diet very strictly. These were folks who were okay in how much they followed, and these were like, what am I doing here? Why am I here in this conference? So. And then the latest understanding of heart disease, and as I said, we have evolved from just cholesterol, heart attack. No, right? We know now it's inflammation. We know it's antioxidant, not having enough antioxidants. And now we know it's your gut. Imagine that. It's your gut. So we now understand that the gut bacteria, how the population balance is in your gut, whether it's predominantly unhealthy, harmful bacteria, or do you have a predominance of healthy bacteria in the gut? All of that determines whether somebody is going to actually have blocked arteries and heart attack as well. So it's a very complicated slide, but I'm basically saying that, let me just walk you through this simply. There is this particular chemical that they measure in urine and blood, TMAO, and that comes from some of the amino acids that are in food, like choline and carnitine. It's broken down by the body to lead to this chemical, which is harmful, and it actually can increase the risk of clots in the artery, leading to heart attack, stroke, and all of that. And so they found that depending upon whether somebody is eating a standard diet, omnivore diet, or a plant-based diet, their blood level of TMO and their urine levels can be different. So this is the plant-based folks. their levels are pretty much flat, and you can see the omnivore diet. So what happens is in this study, these are patients who have been eating plant-based for a while, and these are patients who have been eating standard American diet, and they actually were given foods that are high in carnitine and choline. And I think including these vegans were given like steak and everything for the experiment. And then they measure their blood and urine to see actually if the numbers go up, and the numbers don't go up for the plant-based folks. I'm sorry, for these folks. That's because their bacterial population is very different from those who are exposed to a standard American diet. So when we're eating dietary fiber, fruits, vegetables, and whole grains and legumes, that fiber is what these good bacteria thrive on. They need the good bacteria. That's what they eat. The undigested fiber that we don't need, but they need it to survive. So the good bacteria needs that. So the healthy bacteria connection to heart has been very revealing and innovative that we understood it. It came out in 2013. And this is from 2019. As you can see, August 2019. This is the Journal of the American Heart Association, pretty much concluding after years of data that eating more plant foods is basically how we can prevent and manage heart disease and death related to heart disease and death related to any cause, all-cause mortality. All-cause mortality, except maybe coronavirus and things like that, I think. But all right, so they concluded diet consisting predominantly of plant foods that are lower in animal foods were associated with a lower risk of heart disease, death from heart disease, and death from any of the disease in the general population. Diets that are higher in plant foods, lower in animal foods may confer cardiovascular health. I mean, I think the American Heart Association, again, listening to what the data is showing, their guidelines is slowly changing, right? You can see. The Endocrinologists Association, the National Endocrinologists Association, for the diabetes guideline, they have also slowly evolved and caught up, and now the guideline pretty much says, more plant foods, and omega-6 and omega-3, you got to watch that, and all those discussions are already there. So how do we, there are two types of plant foods you can talk about. This is kind of a general trend. One is a Mediterranean diet, practiced in some of the Mediterranean countries. And again, what do you see generally, what strikes at you when you see these two pictures? Color, right? The color, the vegetables, the fruit, that's the predominance. And then, in the Mediterranean diet, you will have fish, and you will have maybe poultry maybe once a week. You will have olives and olive oil, and maybe extra more nuts than it would in this diet. So that's kind of that is nuances. I don't care where you land, but I think it's important to know just more vegetables, more fiber, more legumes, and less of processed food, less of animal foods, less of oil and salt and sugar. So I think that's kind of the direction I want to set. Everybody has to make their own choices where you want to end up with. As I said, it doesn't have to be A to Z, but just move from A wherever you are. I think that was that. Questions? Yeah. Thank you.